And now to some health matters. Nigerian hospitals, including the renowned Obafemi Awolowo University Teaching Hospital, are shutting down wards as doctors and health workers relocate abroad due to poor working conditions and recruitment failures. Now, the Nigerian Association of Resident Doctors, NARD, confirmed a worsening shortage of medical professionals within the Behavioural Science, Psychiatry section at OAUTH, being the latest casualty. Now, the NARD president, Dr. Dele Abdullahi, warned of the dire consequences, revealing that a one-for-one replacement policy is proposed to address the acute shortage, with 900 doctors leaving the country between January and July 2023 alone. He emphasized the urgency for government intervention to avert further deterioration as the healthcare crisis deepens, with hospitals grappling to provide adequate care. Now, to join me discuss this, we're joined in the studio by Bayode Thomas, Country Director, Head of Operations, InstantRad Nigeria. Thank you so much, Bayode, for joining us.
Thank you so much. I'm super excited to be here.
We're super excited to have you join us as well. Now, Bayode, we're talking about the mass exodus of healthcare workers, out of the country. I mean, brain drain is something that we've been talking about for a long time, especially I think it became more serious from January this year. And looking at the statistics from January to July, there's a large number of health workers that have relocated. So I guess the best place to start is to know the causative factors. What is the main reason? What is that thing that the healthcare industry lacks that is making these people relocate in mass, to other countries?
First, we have to understand first that Nigeria, we're a lot of people in Nigeria first, and there are few medical professionals across the country in itself. Even before the brain drain conversation started, there are few number of doctors everywhere, doctors, radiographers, pharmacists, and all that. And the system is not favorable for the professionals because first you're drained by having to relate with multiple patients every day, and at the same time there are no resources available, there are no compensations available, there's no sort of motivation for even the healthcare workers themselves. And these resources and these things I just mentioned now have a huge factors to both the doctors or the healthcare worker having to offer a service properly, and at the same time the patient's also recovering from whatever illness that is wrong with them. You know what I'm saying? So at that point, if the patients aren't recovering because there are no resources to help the patient as much as you can, there's lack of motivation to the healthcare worker, and at the same time you'll find options that exist in other countries where first you are enumerated, second you are properly regarded, thirdly there's so many equipments and resources available at your disposal, and there's a good environment and economy that can help you. So that in itself has caused a lot of brain drain, and it's always seasonal. It's not the first time it's happening. It's happened years before, and it's happening now. So it's like a rave. And my friend got there, and then it's super working seamlessly. It's reduced shift hours, no more 72 hours shift or 24 hours shift. It's now shorter shifts and very comfortable, quote unquote comfortable, not necessarily like it's really comfortable, but it presumes as that, and people just want to live and look for a better life. Although when we eventually get there, we see that we're living life again, not like it's that different from the experience we have, but it's a
relatively better.
It's relatively better. Exactly.
So this is a problem, like we said before. It's been a problem for a long time, right? And, there's been a debate on the table as to whether or not people are relocating en masse because they are impatient or because the government is not paying enough attention. Now, this is what I mean. Like we said, it's a problem that has been, right? And for that much damage, it takes a lot of work, to get to the point where we want to be in the health industry. So is it that these healthcare workers are not patient enough? Or is it that there are no changes being recorded at all? The problem has been the problem, no improvement whatsoever.
If you look at life generally, healthcare, there were times where healthcare workers were like they are always rated top tier
Yes.
in the country. But now look at the system now, you see your counterpart probably in other sectors and, doing super amazing. You can imagine how much, investment goes into the entertainment industry or goes into other sectors, into tech and all that. And you look at the investment coming into the healthcare space is super low. Most of the tertiary facilities, secondary facilities, they are literally still the same way they were years ago, right? And that in itself is there's no sort of forward-thinking position for any healthcare worker in Nigeria, to be very honest, right? Because it's not getting better. There are reduced hands, and because there are reduced hands, those who are waiting, those who stay back are drained with multiple work, and the environment is not even toxic because the medical practice in itself is a new training model. It's not like I finished from school and then I'm working. Working is school again because you are probably doing residency. If you're a doctor, you're doing internship, or you're trying to scale through the ladder, which means at every point you have to pass one exam or the other. And having to do that, you're literally under a boss who is who you literally look up to the boss to scale through to your next level. So that is not even palatable. It's not a palatable experience for anyone. And you look, and there's some situations that you find yourself that you're working in a facility that don't have enough resources, equipment, and all that. And we're not doing the standards like other hospitals will. We have to compromise standards for patient care because healthcare is pretty expensive. That in itself is not even satisfying. It's not encouraging at all. And literally in every hospital outside the country, you just find standards, and you just want to go there. You don't want to remain at the same level that you are because beyond just staying back is that you want to improve and you want to do better for yourself. And there are only few hospitals that can offer you that sort of encouragement and fulfillment in terms of being an expert in your field, regardless of where you find yourself, right? So traveling, we say impatience of the people. Yes, a part of it, yes, because it's just the rave. Some of us are just flowing with the rave, not because we've seen a better life, really. To be very honest, I had to step out of the healthcare clinical practice and get into tech, pretty much. I lead operations with a teleradiology company in Nigeria, right? And so I get to travel and all that. But when I get there, it's not as it is, right? It's just normal life. It's like I'm living life. I'm going to sleep.
It's not what they paint it to be.
Yes, exactly. It's just I'm going to sleep. I'm going to wake up. I'm going to go to work. I'm going to come back. It's the same experience. It's just that a better atmosphere and a better economy. Let's say So I will say yes. A part of it is impatience because we're not really auditing and reviewing where we're going to before we get there. We're literally relocating to another country. But at the same time, the government really needs to look into the healthcare space and see it worthy enough as a means of investment that can yield an ROI. We've got a couple of investments into Nigeria. You see the likes of, I don't know if I can mention the hospitals that are already here in Nigeria with, massive investments, and they're doing super well. So I think the country needs to see the healthcare space as a investment-worthy venture that yields an awesome ROI.
I think that's a good note to end this. Thank you so much, Bayode Oke-Thomas, Country Director, Head of Operations, InstantRad, Nigeria. Thank you for giving a better perspective. I really do hope that the government does something about it and that, people are patient enough to see the changes being reflected. Because like you said, no much difference. Really, it's just basically same difference. So thank you so much for joining us once again.
Thank you.
Well, that's all we can take on the news at this hour. Thanks so much for watching. Do watch us on News Central Television and DSTV channel 422, Star Times 274, Avo TV and YouTube. My name is Blessings Mosugu. Many thanks for watching.